Hey everyone, what's going on? We're going to start the Healthy Minds topic with the first webinar. And basically what we will be covering in this session is the history of mental illness, effective coping strategies, resilience, and protective factors. So what is a healthy mind? So a healthy mind is free from distressing symptoms of mental illness or mental disorder. As you can read, you're not silly, but we're going to start looking into the history of mental illness. So if you search further enough into it, even just a Wikipedia search will give you the fact that it used to be associated with demon possession and evil spirits. You got older methods of curing mental illness included near-death experiences. A lot of asylums back in the day had limited success rates with cures, that they became overcrowded. So mental illness was not really taken kind to back in the day. So after the last 40 years, we started to introduce psychotropic drugs, and the need to hospitalization has changed, so now they accept most people will be discharged from hospital and return back to the community after effective combinations of medication and ongoing cognitive behavioral therapy, and we'll look into that a little bit later. And the cultural use of mental illness, I'll leave that there for you to stop and have a look at, but it's just the way that media presents it, so it's an interesting little backstory, but I'll let you guys look into that yourselves. So how do people deal with difficult events that change their lives? I want you to think about that question for a bit. But many people react to such circumstances with a flood of strong emotions and a sense of uncertainty. But everyone does deal with it differently, and that's why we have lots of different ways to categorize, different disorders and such. So one thing to consider is resilience. So what is resilience? So it is the process of adapting well in the face of adversity, trauma, tragedy, threats, or even significant sources of stress, such as family or relationship problems, workplace problems, you name it. Like, I'm sure you all have been through something slightly not savory or great, so we can all relate to this, and we use our resilience to bounce back from those things. So I'll let you pause on these slides and start going through it a little bit further, but resilience is you already know what resilience is, it's just the way that we apply resilience. That's really important in this course, or in this topic actually. So what factors actually do make you more resilient? So the factors that make you more resilient are having skills that enable you to soothe and relax yourself, and attitudes that are positive. So being temperate, kind, and self-supportive in ways to evaluate yourself and your achievements helps you you come back to Maslow's hierarchy of needs that we sort of looked at in the past topics. These things, it's sort of like that triangle effect, like you want to meet these things first, and resilience is a very important part of all that. Even though it's not explicitly said in that hierarchy, it's very important to sort of consider in the scheme of things. You're taking the time and effort to understand your reactions to distress and to express them in the ways that are helpful to you without alienating others as well. That's just point 3 there. We do need to look at risk and protective factors. It says hyperlinked above, but what I will do is I'll basically get Lauren and Alicia to upload all of my handouts to the portals, and they're very, very helpful in terms of doing risk and protective factors with regard to the 4 levels of explanation, which we'll look at a little bit later. Don't consider that now, but the handout's really important and it will help with your studies a lot. So what is a risk factor? So it's the increased risk of mental health problems. And what's a protective factor? So it's the reduction of the likelihood of mental health problems. Sorry, that slide was written really horribly, but I'm like 4 minutes in, so I don't want to re-record it. But yeah, so reduce the likelihood of mental health problems. So I've just got a list of your protective factors here, and I want you guys to sort of pause that and go through it. So basically what these protective factors encompass is like environmental or personal resources that help people fare better in the face of stress. So just pop through that table and then take out a few of those. They're very, very, I wouldn't say essential for the exam, but it's very important to sort of have like an idea of these protective factors so you can apply them to moments in your exam. If you ask a question about protective factors, you'll know exactly what to say because you've at least memorized one half of this table, And effective coping strategies. So developing a healthy mind and preventing a mental illness is basically what effective coping strategy means. And so from the textbook we sort of see that the main strategies for developing a healthy mind include planning and problem solving, dealing with distress, social support networks, challenging thoughts, learning optimism, and exercise. All very, very important. So consider those not only for your own well-being, but very helpful and applicable to the exam if asked. And this is just a little further on effective coping strategies. And I know you guys like to pause and just sort of go back and reflect. So I want you guys to sort of pause this slide, have a little look at these ones, and see, main strategies that help alleviate anxiety and certain other depressive symptoms to improve it. So these are basically things we've already talked about and things that we do in our own daily life. And like, I know I go to the gym sometimes and I'm feeling a little bit down, so it's just very helpful. And then other strategies like assertiveness training or relaxation or meditation, time management training, all very, very important. So we'll move on. We go back to assertiveness training a little bit in a further PowerPoint, so just keep that in mind. And we've got these external and internal assets, and they can assist us with being more resilient when faced with adversity. So I'm fairly sure that this stuff is not in the exam, but it is very, very interesting, and it does help in terms of just understanding your well-being as a whole. So what I will do is just go through these slides with you just quickly, and you can pause, and sorry, I keep going back and forth, but you can pause and then stop them when you need to. But these are actually very, very interesting. So you've got your caring relationships and your external assets, your high expectations and your meaningful participation. So just have a look through those, have a quick little check and see what you think of those. And in terms of your internal assets, you've got social competence, autonomy, and sense of self. Now don't stress too much about these because they're not going to be in the exam, but they are good to consider. And same with your internal assets here. Further, sense of meaning and purpose. Easy. So that's just like the first little webinar. I kind of sort of rushed through it, but I want you guys to sort of go through, pause and reflect, and then in the further PowerPoints I'll have a few handouts and stuff for you guys to start looking at and comparing notes with. Easy. Thanks guys.